Good day, listeners. I am Nena Ezine from SAHEL Medicare Center from number 4 Amadou Bello Way, Katsina State, from the dental department to be precise. Today, my people, we are here to talk about the benefits of routine dental checkup. That's dental checkup that you have at least 2 times in a year. That's every 6 months. Now we'll move over to the machines we have. In SAHEL Medicare Center, we have varieties of modern equipment, like our X-ray machine is a very modern one. With that X-ray machine, we'll be able to assess whatever issues a patient is having with his or her teeth. In this X-ray machine, we'll be able to find out some of the underlying issues that is bringing about decay, pain, and some other complications that we may not be able to see just by looking at the patient's mouth. And we also have a dental chair, a modern one that supplies water, a very clean water, distilled water. Also, we also have a monitor attached to it. With this monitor, the patient can be able to see his or her mouth, every structure inside his or her mouth. Now, with that monitor, we also can be able to assess, some areas we can't really see. But with this monitor, we can be able to assess every part, both the hard structures and the soft tissues in the mouth. That way we can be able to see very clearly on the TV, on the television, how or the things that are inside the patient's mouth. The patient also can be able to see what's being carried out in his or her mouth as we progress with the treatment. Also, we wish to use this model to demonstrate to you what it feels like to have this routine checkup, the benefits, because now this is the only thing we can use. We advise patients that every 6 months you come for routine dental checkup, because most of us brush the wrong way. Almost half the population of our people, we brush the wrong way, and that brings about so many troubles, so many issues, so many dental issues that most of our patients present today. Now, most of our patients, we brush this way, this up-down motion. Now, some of us too, we brush this way, this row. And some people also, when you find out the type of brush they are using, is very hard. So imagine using a hard toothbrush on this surface. Remember, these are soft tissues, these are gum tissues, and then when you keep using that hard toothbrush, you keep brushing this up-down motion, you are chipping off this gum, thereby exposing the roots. So when you chip off the gum that is covering the root region, the roots will be exposed. And that's when some of you will come to the unit, they are complaining, whenever I take cold water, it shocks me. Whenever I take cold breads, it shocks me. Whenever I eat anything sweet or something hot, I feel this very hot sensation. This is because of this. And then some people, they're actually using medium toothbrush, but still they're brushing the wrong way. So we advise patients, please, when you want to brush, please get a medium toothbrush. Adults, medium toothbrush, no hard brush. Some people think that when you're using the hard one, that's actually when it cleans the teeth better. No, it's not like that. It's actually the method you use in brushing and how good you do it. Some also, there will be so much in a haste, they will not even take their time to brush their teeth very well. That's why some patients, even after brushing, their mouth stays smelling. That's bring about halitosis. So we advise patients, please, when you want to brush, please, your brush has to be down, this way, like this. You brush from the gum region upwards, from the gum up. That's below, inside, not like this, not like this. Some, when they want to brush, they will close their mouth. Please, you don't close while brushing. Your mouth has to be wide open. This way, wide open. This way, on the upper part, like this. On the inside, like this. From the palate, you brush outwards. That way, the bristles of the brush can be able to penetrate these spaces we are having here. But when you keep brushing like this, I'm telling you, the bristles cannot penetrate. When it's still up down motion, the bristles still cannot penetrate. So we advise, please, down from the inside, then upwards. When you come to this frontal part, that's the anterior aspect of your teeth, please, on the inside, it has to be this way, outwards. On the upper part, has to be this way, outwards. So you brush like that. So most patients, after brushing, they barely brush their tongue. So like this model, we don't have the tongue attached to it, but some have the tongue attached to it. So in this case now, we don't have the tongue. Please, we advise you protrude your tongue, bring it out. Ensure you brush your tongue very well, because after you brush your teeth, but you did not clean your tongue, your mouth is still going to smell. Now, some patients, when they want to brush their tongue, they feel like they are vomiting. So that way, when you feel like that, we advise you can just try it. You close your nose, bring out your tongue, in order to prevent that feeling of throwing up. It actually works. So I think that will be all for the proper way to brush, and we advise patients, please get a medium toothbrush, not a hard one. In conclusion, I wish to encourage everybody to always have a routine dental checkup, especially have the washing done, that the scaling and polishing every 6 months. As they say, prevention is better than cure. With this scaling and polishing every 6 months, you'll be able to remove all the debris, all the particles, all the debts that might be bringing about every other dental problems or challenges that you might have. During this routine checkup, we will be able to assess and find out if a particular tooth is going to have issues in some time or in months to come. That way we can be able to take care of that issue before it gets to a more complicated issue. We also advise patients, please feed well, take more fruits and more vegetables, and make sure you smile always. Thank you. As we visit dental clinic, SAHEL Medicare Center, for a brighter smile tomorrow. Thank you.